I was born in Beaumont, Texas, raised in Dallas, Texas, then got a football scholarship and attended the University of Michigan. And from there, I decided I wanted to be a doctor. Well, it was actually before I got there. I went to Michigan because of the football and the great pre-med program. I've been with Lifestyle Lift probably a total of, I think, 8 years. I took a little 2-year hiatus. I've been part-time, enjoyed immensely, and I've probably done about 3,000 procedures or more. For me, it was always either be a physician or an architect when I was in high school. I distinctly remember. And I think I said I'll try to be a doctor first, and if I didn't go to med school, I'd then apply to architecture school. In any event, I think it was perfect because it allowed me to mesh the two together. I'm kind of artsy. I kind of like the architecture dealing with, measurements and fine lines and detail. Well, the thing I like about it, first of all, is that the patients are relatively healthy. And what you're trying to do is help them go from a sense of not seeing the person that they feel like to achieving a goal of matching the outside to the inside and the way they feel. So here at Lifestyle Lift, it's a lot of fun. We have a very good staff. We really enjoy what we do here. The techs and I, when we're in surgery with the patients, we might be relaxing them by joking with them a little bit or talking them through portions of the procedure or talking about their families or what have you. And so it really becomes a learning lesson, if you will, where we're actually learning about the patient and they're becoming more at ease about the procedure that they're having done. Well, I actually saw one of the advertisements and called thinking that it was a new procedure that I needed to know about in my private practice. So when I called, they said, oh no, it's not a new procedure per se, but what we do is we hire physicians to execute the procedure for us. We do facelifts in the office, and it intrigued me. So I was like, wow, this would be kind of cool, if I could step away from my private practice for a while and not have to worry about the headaches of running the business, getting the patients, that sort of thing. Well, personally, my family is most important. And of course, my health is very important. I try to take good care of myself so that I can be here for my family. Professionally, I think it's just taking pride in my work and doing good work so that I can have patients out there that can always say that they really enjoyed the experience that they had with Dr. Smith. Well, I like spending time with my family. I have 2 college-age girls, and I just got back from a trip visiting them in college, so I do that with my wife. I do enjoy playing golf a lot. Golf for me is very therapeutic. It allows me to get outside and just sort of end my day, if you will, by being next to Mother Nature. And that really helps to kind of just decompress me after being operating for most of the day or what have you, and making these critical decisions and things like that. So golf really helps me. And then I take art lessons and photography lessons and guitar lessons, things like that, that just allow me to just be the other me that I am. I empathize with them going through the decision-making process of who to trust to do your face. And oftentimes when I'm performing the procedure, I ask myself, how do people get to the point where they actually trust you enough to say, okay, I want you to do surgery on my face, and I trust you to do it. I think it's a remarkable act on their part to give you that. So I take it very seriously, and I'm very appreciative of the patients who go through with the procedures because it tells me they have a level of trust with me that I was able to gain. The other thing is that I truly enjoy what I do, and I take great pride in what I do.